Aspirin may lower chances of death in hospitalized COVID-19 patients, study finds. Aspirin is one of the most common medications you can buy at drugstores without a prescription. Mainly used to treat pain, fever, and headache, aspirin is also used to minimize the risk of heart attack and stroke. Recently, a large study explored whether aspirin could help COVID-19 patients in hospitals. Researchers found signs that the drug is linked to positive outcomes. According to the US FDA, the drug facts label on medication products will let you choose aspirin meant for relieving headaches, pain, swelling, or fever. But the label doesn't tell you how to use the drug for lowering the risk of heart attack and strokes. You need to consult with your healthcare provider since aspirin isn't for everyone. Side effects like stomach bleeding and kidney failure are possible. Your doctor will assess to know if your body should or should not take aspirin. The hassle means ruling out potential issues with aspirin, such as allergy, medical history, and pre-existing health conditions, which may badly interact with a drug. On the JAMA Network Open, researchers at George Washington University published the findings from the world's largest cohort study. It showed the possible benefits of aspirin in hospitalized patients with COVID-19. However, the team didn't find a causal effect in this study. They could only show an association between recovery and aspirin. So, it would be up to doctors to use aspirin for these patients if everything else has been exhausted. This is our third study and the culmination of 15 months of work looking at aspirin use in hospitalized COVID-19 patients, said lead researchers Jonathan Chow. In this study, researchers analyzed the data of 112,269 patients hospitalized due to moderate COVID-19. The large data set was dated from January 1, 2020 to September 10, 2021, obtained at 64 health systems in the US. Researchers determined that giving aspirin on the very first day of admission was linked to a 1.6% reduction in mortality. Patients who received aspirin on the first day also had a lower chance of developing blood clots. A lower risk of blood clots would cut the odds of heart attack and stroke. Patients with advanced age and even those with pre-existing health conditions benefited from early aspirin therapy as well. Aspirin doesn't kill the COVID-19 virus or make the symptoms disappear. Its known benefits like controlling fever and swelling reduce the burden on the body. With the risk of blood clots reduced, some complications might be avoided. The findings offer doctors something effective and accessible for treating hospitalized COVID-19 patients. Do you keep aspirin at home? Do you use it frequently to treat pain or headache? Share your thoughts in the comment section. Till our next video, thanks for watching.